Bipolar disorder is a mental health condition that causes one to have extreme shifts in behavior, mood, and energy. Bipolar disorder is predominantly caused by genetic factors, however, environmental aspects have some impact as well. There are approximately 6 genes that contain genetic variations that impact one's risk for bipolar disorder, one of the most important being the CACNA1C gene. Scientist Jiramu Oru states that the proteins made from this gene have functions ranging from neuronal regulation to synaptic transmission to maintaining membrane domains. It makes sense that these variations affect the gene expression of the proteins that impact bipolar disorder because they code for different amino acid sequences. Subsequently, these amino acid sequences affect many neural and behavioral aspects of the brain. Since there are so many genetic variations that factor into bipolar disorder, I'm sure you're wondering if it can be tested. We have created a SNP chip test that can identify genetic deletions, insertions, and variants in regard to bipolar disorder. Our test will contain 50 genetic variations since there are approximately 50 variations that increase the risk of having bipolar disorder. One of the most important variants includes the CACNA1C gene, which works to provide instructions for making calcium channels in the brain. The risk variant of this gene is one of the most reliable genetic predictors of bipolar disorder. Dr. Anna Sternosqua states that this variation is non-coding and causes increased methylation of the CACNA1C gene, which in return is highly associated with having bipolar disorder. Using SNP chip testing throughout the genome is useful because our technology is able to harness actual genotype data. Dr. A.W. Charney states that this allows us to estimate the variance in liability to the disease that can be attributed to SNPs across the whole genome. It is always beneficial to get a genetic test if available, especially with a disease such as bipolar disorder, where there are a multitude of genetic variations that have a strong correlation to an increased risk of having this disease. Getting genetically tested for bipolar disorder can also help one to better prepare for the symptoms and be able to live with it more fully. However, there still may be unknown genetic variations that impact this trait, thus giving our test some limitations. Certain genetic variations have been associated with increased risk for bipolar disorder, although most are calculated to be of low effect individually. Mauro Bertoli suggests that not all raw genetic data is validated, so people may develop serious anxiety or a false sense of security after seeing inaccurate or inconclusive results. Most current psychological models of health-related behavior consider emotions to be very powerful motivating factors in the decision-making process. Emotions caused by possible false positives or false negatives might lead some individuals to undergo unnecessary diagnostic procedures or lead others to avoid appropriate ones. Testing positive on a genetic test can not only take an emotional toll on you, but also a financial one. Testing positive for a disease like bipolar disorder can not only induce fear and worry, but also possibly make the patient undergo unnecessary medical extremes. Financially, getting a test like this done can cost a couple $100s. Other concerns one may have about genetic testing can include the accuracy of the results, how invasive it is, and the privacy concerns such as hacking. When thinking about getting genetically tested, the key thing to remember is that your genetic data identifies you and makes you uniquely you.